This is probably the fourth or fifth time I've gotten Pristiq or desvenlafaxine, so let's talk about it. So this is what Pristiq or desvenlafaxine looks like. So I want you to pay attention to that structure and pay attention to this OH group right here. Now this picture is venlafaxine, also known as Effexor. And if you notice this little group here, there's no OH, just an oxygen. When we take venlafaxine, it goes through your liver through something called cytochrome P450. Bear with me, I'm just trying to teach some pharmacology while we're at it. And cytochrome P450 has a million different enzymes that metabolize a whole host of different medications. The enzyme that we care about is CYP2D6. I'm going to leave this up for a while so you can take a look. There's substrates, inducers, and inhibitors. Substrate means this is a molecule that gets metabolized by CYP2D6. You see our buddy venlafaxine up there. An inducer is something that hyperactivates CYP2D6. Now here's an important concept to grasp. If something hyperactivates a metabolism, what ends up happening is that drug is less in your body, so the effect is lower. With an inhibitor, it shuts down CYP2D6, right? Which causes then more of the drug to stay in your body. So you get a higher dose by being on a smaller dose. Now, this diagram is not even totally complete because something like tramadol, which we talked about in the last video, is also a potent inhibitor of CYP2D6. And just so you know, CYP2D6 has the largest variability of any cytochrome P450. Meaning there's some people out there who naturally metabolize quicker or lower or slower or faster. And also depending on your general health, like how hydrated you are, how well you take care of your liver, right? That will tell you how you metabolize these medications. What's the purpose of going through that entire conversation? Desvenlafaxine skips going through CYP2D6. So it saves your body an extra step of metabolism, which is not just being nice to your liver. It actually may reduce the side effect burden. If people can't tolerate venlafaxine, they might have a better time with desvenlafaxine because they don't have to rely on their conversion if they're not necessarily that good at metabolizing. And this is its binding profile, right? The serotonin transporter and the norepinephrine transporter. And remember, affinity, the lower the number, the tighter the binding. And you will see that it inhibits serotonin about 10 or 11x greater than the norepinephrine transporter. So this medication initially is way more serotonergic than it is norepinephrine. I'm a big fan of Pristiq. People don't tend to have side effects with it, and they tend to do pretty well on it. Let me know if you have other medications you want me to talk about.